And conversations about depression and anxiety are getting more candid in the wake of the COVID crisis and the current unrest in America, including former First Lady Michelle Obama.
These are not, they are not fulfilling times spiritually, So I know that I am dealing with some form of low-grade depression, not just because of the quarantine, but because of the racial strife.
Michelle Obama giving voice to what a lot of people are afraid to admit. Dr. Judith Fiona Joseph, a psychiatrist based in New York, is here to tell us and help us address this sensitive issue. So good morning to you, doctor. How you doing?
Good morning. Thank you for
having me. I'm so glad we are having this conversation because it doesn't get talked enough about, and I'm glad Michelle Obama is a voice behind this. So in her podcast, she talks about suffering from this low-grade depression, but what are the signs of that?
So I'm so glad she talked about it too. It's something that I think is so validating because it shows that depression can affect us all. And some of the signs of a low-grade depression are feeling tired, having poor sleep, feeling irritable, just feeling sad for no reason, and having changes in your appetite and, really in your ability to enjoy things. So I think that what she's talking about is a perfect storm for depression. You have social isolation, you have massive death, and now you have all of this racial turmoil. And if she's talking about it, guess what? It's reflective of how a lot of us are feeling.
Yeah, and you said it affects us all, or could affect us all. And I think that's really important to point out because you're not alone in this fight. And you might say, okay, I feel like I'm feeling something. I don't want to talk about it. So what's your advice for somebody who may be feeling that?
So I think that taking care of the basics is really important. If you're feeling this way and it's affecting your functioning, really, you should talk about it. And one of the things that I say is you have to validate that. First, acknowledge that you're feeling that way. Then talk to people like a therapist or a friend or family member, and then you can do something about it. And really take care of the vitals, which is getting good sleep, getting good eating the nutritious meals, really taking care of your body, getting movement, getting exercise. It's really important to take care of the basics. But most importantly, validate your feelings and talk about it.
Over the weekend, a Black Lives Matter activist actually admitted that he was traumatized after being involved in a bit of a standoff with cops on Friday who surrounded his apartment. Now, does this type of trauma ever go away? Is there something that could be called a low-grade PTSD, for example?
So generally, PTSD happens when something traumatizing happens to you. If this person felt like their life was being threatened, they can have a lot of, stressful reactions to this after the fact. And so, just like everything else, like depression, PTSD can be on a range. You can have lower grade PTSD compared to higher grade. However, it's really important that this person feels safe. And the first step for trauma survivors is that they're not blamed. You didn't bring this onto you. You didn't do anything to deserve this. And you're safe. So, if people keep seeing these traumatizing things in the news and they keep getting re-traumatized, they don't feel safe and they don't feel validated.
I'm curious to know if you've actually seen a difference in the types of folks who are coming to seek your health advice during the pandemic and the protests.
Certainly. I'm seeing a lot of people, especially people who are, Black and brown, coming to me and saying, listen, I'm having heightened anxiety, worsened sleep because of seeing all of these images in the media. And they're having these kind of stress reactions that people typically have if they've personally experienced a trauma. And so, I'm seeing an uprise, especially in my Black and brown communities, of stress, anxiety, and depression.
I have been very open with the fact that I have anxiety and suffer from anxiety, and it's not something that is easy to deal with because you do lose a lot of sleep, and there's always this hamster wheel going on in your head. So are we all at risk from suffering some kind of mental health issue because of specifically coronavirus?
So from what we know about post-pandemic and pandemic psychiatry literature, a lot of people will experience irritability, poor sleep, low-grade depression. But the good news is that most of us will recover. There are some vulnerable populations, like the elderly, frontline workers. And I think in this particular case, people who view this trauma, especially the racial trauma, and take it personally, I think those people will have a harder time. So it's important to get care right away and to get help right away.
Dr. Joseph, I'm so glad we're having this conversation because I think it's so important. Mental health is a huge topic that people feel taboo about talking about, so you're welcome back anytime.
Thank you for having me.
Thank you very much.